Currently, we have 33,459 cases. This has been a very busy week with many, many cases being reported over the course of this week. And this represents an addition of hundreds more cases since the last time that we updated. We are in red for this week, but we anticipate that we will be in purple next week. We just found out from the testing task force yesterday that we're getting 3 more OptumServe sites. So these are going to be currently planned to be in Selma, Reedley, on Butler Avenue here in Fresno. And we're thinking about even requesting a 4th one out in Mendota. So those are tentative locations. They haven't been set in stone. We actually do a walkthrough. Dave Palmaville is actually visiting some of those sites this afternoon because we want to make absolutely sure that these are the right fit for what's needed. But these are going to add 450 to 600 additional tests into our county that we can be doing if we use them to their full potential. We're actually coming up with some guidelines to help our agricultural partners and other high-risk occupations figure out how to do surveillance testing for their employees. And right after this call, I have a call with area hospitals where I will be bringing up the concept of doing surveillance testing with our healthcare workforce. With our healthcare workforce, we want to make sure that we're protecting them, especially going into the winter season, seeing these numbers surging the way that they are. We absolutely need to protect our first responders and our healthcare workers. And doing surveillance testing is one important, just one, but very important component of doing that. More good news. So there's a product that is created by one of the pharmaceutical companies. I believe it's Eli Lilly. This is a monoclonal antibody. And this actually neutralizes one of the components of the virus. And the pharmaceutical company is now providing allocations of this to different counties across the state. So just like with remdesivir, which was allocated whenever it was first introduced, this is going to be kind of a parallel to that program where area hospitals can take advantage of this program and get an allocation. This is an antibody infusion. It's called bamlanivimab. Sorry, I'm probably mispronouncing that. Bamlanivimab. I couldn't find a trade name for it. But this is a one-time infusion that can be given to high-risk patients who are not going to be admitted to the hospital. So as soon as you get diagnosed with COVID, this could be something that if you are considered high risk, the physicians could offer to give a dose, and then hopefully it will help you recover faster because you have antibodies that neutralize the virus that's replicating inside your system. The state average testing is now up at 270 per 100,000. It was around 230 to 240. However, other counties are just doing a lot more testing, and now the average testing is at 270, while we remain kind of in the 230, 240 range. So we need to be doing more testing, ideally every 2 weeks for essential workers, frontline workers, and public servants is recommended. We really just need to get in the habit of doing testing. This is one more weapon against coronavirus that we now have at our disposal and that we need to be using more broadly, along with the masks, the social distancing, the hand hygiene. Routine surveillance testing is just one more layer of protection that the more we use, the more we can actually benefit from.